Hi, I'm Steve. I'm going to be performing my physical assessment video. I'm going to be using a card just to guide me through it. I'm going to be doing neuro, cardiovascular, and respiratory. This is the card. Uh, and that's the back side of it for respiratory. And it just basically guides me through it. It doesn't describe to me anything special except for the order that I'm going to perform the physical. So I knock on the door and I come in and I introduce myself to the patient. Hi, I'm Steve. I'm going to be performing a physical exam on you today. I close the drape for privacy. And before I start the exam, which I'm going to do the exam system-wise, not head to toe. So I'm going to be covering each system separately. I'm going to check his armband, and I'm going to ask him, what's your name and what's your date of birth? Once that's done, again, I can describe to him, be performing a physical exam on you. I'm just going to start with asking you some questions. And the questions I'm going to ask are, can you tell me where you are? Can you tell me the date, the time, and can you tell me who you are? And can you tell me who the president is? So I've checked for orientation. Patient's awake and alert, obviously. Next, I'm going to do cranial nerve exam. I'm going to start with olfactory nerve, cranial nerve 1, and I'm going to work my way down through 12. Cranial nerve 1, basically what I'm going to do for olfactory is I need to look in your nose. I'm going to check the patency of his nares to see if there's any deviation. Next, what I'm going to do is tell him to close his eyes, and I'm going to check one nostril at a time. Can you please smell that and tell me what it is? And can you please smell that and tell me what it is? So I've checked for smell and also the condition of the nose. Cranial nerve 2 is eyesight, optic nerve. Optic nerve, what I'm going to do for optic nerve is check his visual acuity. And this is a small chart. It's not a Snellen chart. If I had a Snellen chart, I'd have him stand up at 20 feet and do it. This card's done at 14 inches. And I'm going to ask him to read the lowest line that he can and then record the reading. Can you please read the shortest, smallest line that you can? And he does that. Next, I'm going to do cranial nerve 3, oculomotor. I'm going to do 4, and I'm going to do 6 altogether. The trochlea 4 and 6, the abductions. And the way that I do that is by asking the patient to please, can you please watch this? Watch this point, and I'm going to ask him to look in all 6 directions. Can you look there? And he's going to follow my pen with both of his eyes open. Look there, look there. And then I'm going to ask him to look up here, out there, and out there. And basically it's checking the motor functions of the muscles that are controlling his eyeball. Next, what I'll do is pupillary response. I'm just going to shine a light in your eye, and I'm going to take a quick look to see whether the pupils constrict on this side and both sides. And I'm going to ask them on this side to just look straight ahead and see if his pupils constrict bilaterally. I'm going to check what the pupillary size is, so I can jot that down. Also on constriction, what the pupillary size becomes. for that, the pupils. And also I'm going to ask him to look out and follow the pen in to test accommodation. So pupils are equal, round, reactive to light, and accommodation. And so that's 3, 4, and 6. 5 is the trigeminal. Trigeminal, I'm going to ask him to grit his jaws together, and I'm going to feel the contraction of his muscles to grit his teeth and make sure that the muscles here are fine. Next, what I'm going to do is check trigeminal for sensation. And do you feel this? Do you feel that? Do you feel this? Do you feel that? Do you feel this? And do you feel that? So I'm checking for the motor and sensory portions of the trigeminal. So next I'm going to go to 7, cranial nerve 7, which is facial. And I'm going to ask him to smile, make sure that he has equal smiling and that I don't have any sagging on either side of the face and that his face is symmetrical. For 8, which is my hearing, cranial nerve 8, I'm going to ask him, do you hear this? And I'm going to ask him on the other side, do you hear this? So I'm just basically checking the auditory nerve, cranial nerve 8. The cranial nerve 9 and 10, first I'm going to ask him to shrug his shoulders. And I'm going to feel the strength. I'm going to try to press down at them and feel the strength of that. And I'm going to ask him, turn your head to the left, turn your head to the right. Next, what I'm going to do is check his gag reflex. I'm going to say, open up your mouth. And I'm going to stick a probe in there. And I'm going to see if he gags so that I can check that cranial nerve also. Next, I'm going to do cranial nerve 12. Cranial nerve 12 is the glossopharyngeal. And I'm going to just say, stick out your tongue. And to make sure that it's center and midline. That it's midline and that it's straight. After the cranial nerves, I'm going to check for his coordination. I'm going to ask the patient to take his hands and to flip his hands up and down, up and down, up and down. I'm also going to ask him to, could you please touch my finger with one of your fingers? So I'll see if he can do that on both sides. So I'm checking for coordination. For sensation, I'm going to check upper and lower extremities. I'm going to have him close his eyes, and I'm going to check it with soft and with sharp, and have him differentiate on the upper extremities. Do you feel this? Is it soft or sharp? On this side, I can poke them to see if it's sharp, or I can poke the lower extremities. So I'm going to check lower extremities and upper extremities for differentiating between soft and sharp. I can also do and ask him to stick his hand out to see whether he can determine what number I'm drawing in his hand, and I can also hand him an object and ask him, for example, what the object is for stereognosis. Reflexes, what I'm going to do is have him sit up, which I can't here, and basically I'm going to do my patellar reflexes on the knees. I'm going to have the patient sit and cross his legs and check both patellar reflexes with a hammer, with my reflex hammer. And those will be done here, on this part of the leg, and on this part of the leg. And also I'm going to check his feet for plantar reflex on both sides, hitting his Achilles tendon on both sides. And I'm also going to check for a Babinski sign by using the back of my tuning fork. And I'm going to go up the lateral side of the foot and across the toes to see whether the toes curl in and down, which is normal, versus curling up and out. Next, what I'm going to do is a cardiovascular part of the exam. What I'm going to do is inspect the anterior chest and neck. And in the neck, I'm looking to see if I see any carotid pulses. In the chest, I'm looking for downward symmetric ribs in a pyramid formation. Next, I'm going to inspect and palpate the extremities for edema. So on the leg, what I'm going to do is press in behind the tibial bone, right above the ankle. And on the back side of the tibial bone, I'm going to press in for 5 seconds. I'm going to hold it and then release it, and to see whether or not there's any type of edema, and rate it from 1 through 4. Next, what I'm going to do is palpate all the pulses. I'm going to start with the carotid pulse. I'm going to check one side at a time. I'm going to check for strength, and I'm going to grade it on a score of 1 to 4. And in this case, it's a 2+ on this side. And I'm going to check the other side, and it's a 2+ on that side. And the other pulses I'm going to check are temporal. I'm going to check for his brachial. I'm going to check a radial pulse bilaterally now. The only one I did unilaterally was the carotid. Then I'm going to go down to his legs, check his posterior popliteal pulses if they're present or not on both sides bilaterally, posterior tibials on his legs, and then dorsalis pedis on the top of his foot here, and then the posterior tibial here, and the femorals here. Next, what I'm going to do after I palpate the pulses and rate them, I'm going to check the skin turgor to see his level of hydration. Then I'm going to do just below the clavicle, and I'm going to pull up the skin and then release it to check for elasticity, and for if there's tenting, it means the patient's dehydrated. If the skin stays up and doesn't snap back into place immediately. I'm going to auscultate his heart sounds. Auscultation, basically, I'm going to find the landmarks here. And the landmarks are, I find the angle of Louis on the sternum, and go over to the right, second intercostal space on the right, because angle of Louis is at the second intercostal space. So my 5 points I'm going to check are the right side, second intercostal space, left side, second intercostal space, third intercostal space alongside the sternum, fourth intercostal space along the side of the sternum, and then go mid-axillary line in the fifth intercostal space and check the mitral. And using the mnemonic 8 to man. So in that order, it would be, this is aortic, pulmonic, tricuspid, Erb's point, tricuspid, and mitral. Those are the 5 areas I'm going to check to listen to those valves specifically as named in the mnemonic. Also, I'm going to check an apical pulse, which is the mitral area, and I'm going to see if I can feel it, and I can time it. I can do a rate and rhythm, rate and rhythm, whether it's regular or irregular, and what the rate is. And also I would check the radial pulse to see if there's any difference between the rate and rhythm that I'm finding between the apical pulse and the radial pulse. And next I'm going to auscultate them. I'm going to hear S2 sound best at the base of the heart, and S1 sound best at the apex of the heart. S1 being systolic and S2 being diastolic. So I'm going to check here. Go to the left side, second intercostal space for pulmonic. Herb's point, third intercostal space, sterile water. Fourth intercostal space, sternal border, tricuspid, and then mid-axillary line, fifth intercostal space for mitral valve. Next, what I'm going to do is respiratory, and that'll be the end of the exam. Respiratory, I'm going to inspect the thorax and check the ribs again so that they're downward sloping. And I'm going to check AP diameter, which should be approximately 2 to 1. So wide here to about 1 here. Checking for emphysemic changes, such as a barrel chest, which would then cause the chest to become barrel shaped, and I have closer to a 1-to-1 ratio in my AP diameter. I'm checking for symmetry, and I'll check his respiratory rate for at least 30 seconds. Next, I'm going to check the nail beds. Basically, what I'm going to do is check the nail beds by pushing down on the tip of the finger, and they blanch, and then I'm going to let go of it, and I should have capillary refill within less than 2 seconds to be able to check the nail beds for capillary refill. I'm going to check skin color and for any lesions that are either on the front or the back. I'm going to palpate the trachea to make sure that it's midline and there's no deviation. Then I'm going to check expansion posteriorly. I would have the patient lean forward and turn around a bit, and I can press a bit of skin together down around lower thoracic area, press some skin together, put my hands on his back, and watch for equal bilateral expansion of the chest. Next, I would auscultate, which is the last part of my exam. I would auscultate the chest. I'm going to be looking for 3 types of sounds: brachial, bronchovesicular, and vesicular. Bronchos I'm going to hear up in the neck and at the apices. Bronchovesiculars I'm going to hear close to the sternal borders on the anterior side of the chest. And vesiculars I'm going to hear on most of the anterior chest and on the back. So I'm going to auscultate. Basically, I'm going from one side, take a deep breath, the other side, take a deep breath, and compare them. Then I'm going to start here, take a deep breath to compare sides. Then I go down, take a deep breath, compare sides, take a deep breath, and take a deep breath. Next, what I'm going to do is check the back. Again, same manner. I'm going to check the apices of the lungs. Take a deep breath. Take a deep breath. Go down. Take a deep breath. Take a deep breath. Go down. Take a deep breath. Take a deep breath. And lastly, I'm going to check the sides. Higher up, and then lower down. Take a deep breath. Take a deep breath, and compare to this side. Take a deep breath. Take a deep breath. And that concludes my respiratory exam. I thank the patient, and I'm done. Thanks.